Good day, everyone, wherever you are. My name is Robert Boyd, and I'm the CEO of the School-Based Health Alliance. Welcome to the final day of the 2022 National School-Based Healthcare Conference. It's been a great week. We've learned a lot. We've had inspirational conversations, and we're looking forward to this final day. A quick commercial. You will want to join us for our last plenary session at 2:30 p.m. Eastern Daylight Time today. Dr. Pedro Nogueira, one of the nation's leading educational voices, will talk about achieving health equity through school-based health. You won't want to miss his informative and inspirational presentation. Now, I would be remiss if I didn't say thank you to our outstanding administrative and tech team that has put this conference together and executed it. Led by Director of Administration Alicia Newell and Senior Admin Tierra Brooks, they've worked round the clock, weekends and holidays, to make this event a reality. Thank you, Alicia, Tierra, and your entire team. You know, it's not easy to pass legislation on Capitol Hill. I'm a former chief of staff, and I've passed a number of bills, and it takes years of building relationships in both houses and both parties. I want to single out the work of Suzanne Mackey, our Vice President of Policy, for leading our efforts in Congress. Suzanne is known throughout our field and the federal government as a reliable source for accurate information. In this day and age, that's a very valuable currency. I can tell you that she is a cool and steady hand, except when I do things that drive her crazy, which is probably once a week. Thank you, Suzanne, for all you do. Our efforts on the Hill would not be successful without the support of our affiliate leaders from the home states and districts of our congressional members. You will see some of them as they introduce our champions. Tammy Alexander is our Vice President of State Relations. She's worked closely with those leaders to earn the trust and support of their representatives and senators. Now, school-based health centers and school-based health care generally right now are blessed to have some powerful supporters on the Hill. They are from both parties and both houses of Congress. They and their staffs work closely with our team and our national partners to put together legislation that improves the lives of children in need. During this session, you'll hear from several of our congressional champions, and it's my high honor to introduce one of them. United States Senator Debbie Stabenow of Michigan is a champion for policies that help our children succeed inside and outside of the classroom. During the pandemic, Senator Stabenow has fought to ensure our schools have funding they need to provide all children a high-quality education wherever they are learning. And her bipartisan Hallways to Healthcare Act will help schools provide comprehensive health care to their students. As chairwoman of the Senate Agriculture Committee, Senator Stabenow is working tirelessly to reauthorize and strengthen child nutrition programs so that schools have the support they need to provide children with healthy foods year-round. Her bipartisan Keep Kids Fed Act was recently signed into law. For her tireless work on behalf of America's school children, we recognize Senator Debbie Stabenow as our 2022 Congressional School-Based Health Champion. Please welcome U.S. Senator Debbie Stabenow.
Hello to all my favorite people, our School-Based Health Alliance, and thank you, Robert, for all of your wonderful leadership as CEO, and to everyone who is involved in this important movement. And a special shout out, of course, to the School Community Health Alliance of Michigan. I so appreciate you and what each of you are doing every single day for young people across Michigan. You know, I realize that the last few years have been really challenging. It's always challenging, but with COVID, it added even more challenges. And I'm so grateful for everything that you did then and you are doing now in your commitment to the children that you serve. I know it's been a lot of work to make sure that all of our students are healthy and able to learn, and that there are ongoing challenges now. We know that. And what you do is even more important than ever, quite frankly. And I know that a lot of people in healthcare, including all of you who serve children in schools are dealing with a lot of exhaustion. I don't blame you, and burnout, and trying to keep going, and you care, but it's just been so tough. So I'm mainly today wanting to say thank you, thank you, thank you, thank you. And I want you to know that your work is so appreciated every single day, and it's needed now more than ever. You can count on me to continue to partner with you to not only tell your story, but to fight for the resources that you need so you can be successful with our children. I have some good news. I mean, we're plotting forward. It's always step by step by step, not as fast as I would like to have happen, but we have good news. As you know, for the first time, the omnibus that we passed earlier this year included $30 million for school-based health centers run by federally qualified health centers. And except for the $200 million I was able to get in the Affordable Care Act for SBHC infrastructure funding, this is the first ever dedicated federal funding stream for school-based health centers. Been a long time in coming. But we are started now. We have a line item. Now, it doesn't do everything that I want and that you want. Unfortunately, it didn't include money for school-based health centers run by other entities like hospitals and health departments. And I've asked the Appropriations Committee this year, as they're doing the next budget, that they include all school-based health center sponsors eligible for funding and dramatically increase the available funding so that you can really get all the support that you need. And that's something we need to work on together. So I encourage you, it's really essential that you tell the story of what you are doing and how the school-based health centers are a critical part of education and support for our young people. So it's important to talk to members of Congress now. Really, this is in the next month or two when the budgets are being initially put together, and to talk about direct funding. It's really important that that line item be increased. Now, on the good news front, again, we just passed the Safer Communities Act, which includes billions in new funding for school mental health and safety program. These are grant programs, as well as funding that goes directly to states. And again, this is the moment to weigh in with your state through the association. And if there's anything that we can do to help you as it relates to information about applying for grants, there are multiple grants in different parts of this new act and funding for school-based mental health and suicide prevention and other issues that are things that would be really important to familiarize yourself with if you've not had the opportunity to do that yet. And I would encourage you to be very aggressive at putting together requests for funding. The other piece that's in the budget that I have worked on for many years, which is why I know this is a step-by-step process. 9 years ago, I started working on fundamentally changing the way we fund healthcare in the community, mental health and addiction services in the community. So it would be like healthcare. So we have federally qualified health centers, but mental health and addiction services have been through grants, just like our school-based health centers. And so both of these areas have been such priority for me to have it be funded like healthcare. Well, 9 years after doing demonstration projects and startup grants and so on, Senator Roy Blunt and I were successful in the recently passed legislation to actually fund nationwide now the opportunity to have quality certified community behavioral health clinics permanently funded through Medicaid as part of the healthcare system with all of the related support for clinics. And this is now going to become a reality. So if your state has not yet become a part of the CCBHC movement, they need to apply through SAMHSA and really begin that process. And this is important because I know that your organization is working with the National Council for Mental Well-Being on expanding the primary care services related to this. There's a comprehensive set of standards, quality standards that you have to meet to get this ongoing funding. And I think what you do is a very important role for that. In Michigan, for example, St. Clair County Community Mental Health used its CCBHC grant to open school-based health centers in partnership with the St. Clair County Health Department. That's just one example. And so this new funding, which is very significant for mental health and addiction services, is going to lead, I think, to many more terrific partnerships and ultimately better care for young people. So I encourage you to really look at this as well if you are not already. Let me finally just say I'm continuing to work with Senator Cavito to get Hallways to Health passed into law, which is really comprehensive view of healthcare and what we need to do in schools to support all of you. We need to get that passed. And I know with all of the challenges that young people are facing, that one of the ones that I hear about, and I'm sure that you're addressing with so many young people right now, is the significant number of young people that have really been struggling in the pandemic, and the number of suicides and suicide attempts that have gone up. So we know that the pandemic only added to these challenges. And in fact, some research show that symptoms of depression and anxiety have actually doubled. And so, and that's not just for young people, that's for adults as well. And so when we look comprehensively about school-based health centers and what we should be supporting and what you are doing and what more you can do, it's really, really important. And you're right there interacting with young people every day. You know the students, you see them in the hallways every day. They are your focus and your priority. And boy, we really need you more than ever, as I said before. Let me just mention two other areas of focus for me that relate to feeding children in school. We just as passed as well something that I had to fight really hard to get, and it shouldn't have been that hard, but unfortunately in the Senate it was, extension of support for summer meals and flexibility for children, increased funding, universal free meals in the summer for our children, something that we put together during the pandemic, as you know, and some additional help for schools to handle both reduce the paperwork, but also be able to have additional funding to help feed children during the school year as well. It's called Keep Kids Fed Act, and we passed it at the very, very end of the session a week ago. And it's very important, very, very important that we get it done. And I'm continuing to focus on child nutrition as we go forward, and welcome your thoughts as we focus on the 5-year reauthorization that relates to children, breakfast, lunch, after school time, to support children to have healthy food so that they can be successful. There's a lot going on, that is for sure. And frankly, what you do is right in the middle of it. I consider it to be the glue. And I know, again, how hard and exhausting all of this must have been and continue to be. I'm really proud to be your partner, to be able to tell your story. Thank you, thank you, thank you for everything you do. We need you now more than ever. You are greatly appreciated. I hope you feel that, because it's really true. So I hope you enjoy the rest of the conference. I'm glad I had an opportunity to say thank you. Hello to all my favorite people, our school.
Thank you so much, Senator Stabenow. I see many thanks in the chat box as well. We truly, truly appreciate those words. It's now, excuse me, my pleasure to share with you that we are giving out from the School-Based Health Alliance some Congressional School-Based Health Care Champion Awards. And we've heard from some of the awardees already during this week. You see here on the screen the 6 awards we will be giving out. First, we're giving to Senator Ron Wyden of Oregon. We heard from Senator Wyden earlier this week. So thank you so much to him and his tireless efforts to support us as well. Next, as we just heard from Senator Stabenow of Michigan, she will be receiving an award from us. And then Congressman John Sarbanes of Maryland. We appreciate that we've gotten to hear from all 3 so far awardees. And we are now going to have the chance to hear from the next 3 awardees. First, we will hear from Senator Patty Murray of Washington State. She'll be introduced by Sandy Lennon of our Washington affiliate, the Washington School-Based Health Alliance. Then we will hear from Congresswoman Deloro of Connecticut, who will be introduced by Melanie Wild from our affiliate with the Connecticut Association of School-Based Health Centers. And then lastly, we'll hear from Senator Cavito of West Virginia, who will be introduced by John Kennedy of our affiliate, the West Virginia Primary Care Association and School-Based Health Network. So we'll go ahead and start hearing those words.
Hello, I'm Sandy Lennon, Executive Director of the Washington School-Based Health Alliance. I have the great pleasure to introduce a true champion for children and youth in Washington State and nationwide, Senator Patty Murray. As a state senator and throughout her time in Congress, Senator Murray has been a strong advocate for children, youth, and families. Her path has included being an educator at the preschool and community college levels and serving as a school board member. Her determination that all students have the opportunity for a high-quality education and a healthy start in life is what launched her into public service as a legislator. She understands the important intersection of health and education for our students to thrive. She sees the value of school-based health centers and has taken a sincere interest over the years, visiting multiple school-based health center sites across Washington and personally welcoming advocates for school-based health care in her office in Washington, D.C. Senator Murray is known for listening intently, leaning into the conversation, and delving into the key issues to determine what needs to be done. She's taken what she's learned to heart, embraces the importance of partnerships between schools and healthcare to address the needs of children and youth, and understands that when these partnerships are supported and resourced, they can have a significant positive impact for students and communities. As chair of the Appropriations Subcommittee on Labor, Health and Human Services, and Education, Senator Murray's leadership was key to the historic $30 million investment Congress made this year to support school-based health centers. As a result, we celebrate today that community health centers are able to establish more school-based health center sites, and others can expand services at existing sites to provide critical health services to children and youth, at a time when we know students are facing many challenges. Because of these appropriations, 5 community health centers in Washington received federal funding to support school-based health centers this year, with many more across the country. On behalf of all school-based health centers in Washington State and the youth, families, and communities they serve, we thank you, Senator Murray, and welcome you today.
Hi all, this is Senator Patty Murray. I'm really glad to join you for this year's National School-Based Healthcare Conference, and I'm honored to be presented with the Congressional School-Based Healthcare Champion Award. Every kid in Washington State and across our country deserves to be able to get the essential care they need to stay healthy. And the school-based health centers that you all run deliver those services, and that's especially critical for students with the fewest resources. From providing annual checkups and physicals to primary health care, counseling, dental services, mental health and substance use disorder services, and so much more. School-based health centers help keep our kids and communities healthy. That's why in Congress, I'm always looking for opportunities to support the important work of school-based health centers and to expand their resources to reach more kids and families around the country. In the most recent funding package, I fought for school-based health centers and was so glad to secure $25 million more to strengthen and expand the work you all do, and I will keep fighting for more. Students across the country depend on the services you provide each and every day. So I just want to say thank you for all you do, and thank you for this great award. I look forward to continuing to be your partner in the United States Senate.
Hello, I'm Sandy Lennon.
Wonderful. Thank you so much for those comments. As I mentioned before, we're next going to hear from Congresswoman Deloro in Connecticut, who will be introduced by Melanie Wild with our Connecticut Association of School-Based Health Centers.
Hello, I'm Melanie Wild-Lane, Executive Director of the Connecticut Association of School-Based Health Centers. I have the honor of introducing someone I most admire today. U.S. Representative Rosa Deloro has been the Congresswoman for Connecticut's 3rd Congressional District since 1991. In 2020, Congresswoman Deloro was selected as the chair of the House Appropriations Committee for the 117th Congress, and she is only the 2nd woman to hold that position. She also chaired the Democratic Steering and Policy Committee from 2003 to 2021, and she is the chair of the Labor, Health and Human Services and Education Appropriations Subcommittee, where she oversees our nation's investments in education, health, and employment. For her entire legislative career, Rosa's work has focused on issues affecting America's working families. Her fight has centered around legislation that would give all families an opportunity to succeed. I could read to you for hours the accomplishments of Congresswoman Deloro and talk for days about her advocacy efforts. Those are extremely important. However, I want to talk to you about her early years, which will explain the type of character she has. Early on in Congresswoman Deloro's career, she was often invited to many engagements, as she still is. Many of them were by me. I was young and new to the nonprofit healthcare world, and I ran a small hometown homework assistance and after-school program in a nonprofit healthcare center in Middletown called The Homeroom. The Congresswoman was often invited to participate in homework time, read to the students, attend a community party. The students loved her. She was not afraid to get down on the floor, to read to them or craft with them, or even hike up her skirt and dance. Her pink, purple, or blue hair would be the talk of the kids. To them, she was celebrity material. They took pictures with her and she signed their homework. But more importantly, these kids felt seen and heard by Rosa. She was genuine and she was caring. She listened with an open heart and an open mind. What she did in Washington was of no importance to them because they didn't really understand it. What they did understand was the way that she looked at each student as they spoke to her. And with both arms wrapped around them, the hug she gave to each of them at the end of talking with them. When she would skip by the program and not stop in, students would rush to the door and yell, "Miss, come in." Even in her rush to get somewhere else, and against the advice of the assistant standing beside her, rushing her off to another engagement, Congresswoman Deloro would pause, go over and say hello to all who were at the door. She never passed up a moment to engage, to support, or to lift up these young, impressionable children. While they may not have understood then what she did or what impact she would have on them and their families, they know now. These children are all now between the ages of 28 and 35. The impact that she has had is immeasurable, as is her character and her heart. Please welcome Congresswoman Rosa Deloro.
Hello, this is Congresswoman Rosa Deloro, representing Connecticut's 3rd Congressional District. I want to thank Melanie Wild-Lane, Executive Director of the Connecticut Association of School-Based Health Centers, for those kind words and generous introduction. Let me also recognize Robert Boyd, President and CEO of School-Based Health Alliance, the national voice for school-based health care. And of course, I must thank all the members of the Connecticut Association gathered here today. It is great to virtually join our nation's school-based healthcare providers and administrators who are gathered today. For nearly 30 years, The School-Based Health Alliance has supported and advocated for high-quality health care in schools for our country's most vulnerable children. You are on the front lines at the intersection of health care and education. It is my privilege to celebrate you today and your mission to achieve health equity through school-based health care. Far too many of our children struggle because they lack access to health care services. That's where you come in. Like you, I have long believed that school-based health care is the solution. It brings health care to where students are. They are in school. The last 2 years have been challenging. The pandemic has taken a significant toll on the mental and physical health of physicians, of nurses, and other health care workers. That is why, as chair of the House Appropriations Committee, I was proud that we provided $30 million for school-based health centers within the Section 330 Health Centers program, an increase of $25 million from last year. It represents an unprecedented and historic investment in operations funding for school-based health centers. In the words of President Boyd, and I quote, "Congress has made an important down payment on school-based health services for the nation's most vulnerable children, and we will build on this momentum in fiscal year 2023, end quote. That is what we intend to do. We are moving aggressively on appropriations. We have analyzed the President's budget request, held 94 hearings over the past several months, and we are moving ahead with markups. And just like the package we successfully passed earlier this year, we are working together to the finish line and get these bills over the finish line. After all, no one chamber or party can do it alone. So my goal is to have these bills on the House floor by July. This means a great deal to me, but I take this not as a reward for past service, but as an incentive to work harder to get things done and to help make a difference for our children and students across our nation. This is a special honor because the Congressional School-Based Healthcare Champion Award recognizes our shared mission to improve the health of our children by advancing and advocating for school-based health care. Continue making your voices heard and do not take no for an answer. I'm grateful to be your partner, and I look forward to continuing our working together for years to come.
Thank you so much for those words from Congresswoman Deloro. Lastly, we're going to hear some words from Senator Shelly Cavito of West Virginia, who will be introduced by John Kennedy. I invite you to go ahead and start.
Hello, I am John Kennedy, and I serve as the School-Based Behavioral Health Director at the West Virginia Primary Care Association. We have the privilege of representing our state's 32 community health centers and also serve as a state affiliate for the School-Based Health Alliance. Collectively, our member health centers operate some 425 sites statewide, with school-based health sites comprising of about half of these locations. Altogether, health centers operate more than 94% of the school-based health sites in West Virginia. School-based health is fundamental to the mission of our state's health centers, and Senator Shelly Cavito has been a fierce and a passionate advocate for both. Recently, thanks to Senator Cavito's efforts and the role of the Senate Appropriations Committee, health centers became eligible for $30 million in grant funding through HRSA for school-based health. That was a $25 million increase over the previous budget year and transformational change. Health centers were excluded from the grant funding early until an authorization in the Consolidated Appropriations Act of 2021. To paraphrase the senator from our virtual Hill Day in March, she supported this measure in health centers generally because they are an easy group to advocate for. This is based on our track record within the state and the difference we are making in the lives of patients in the communities. As funding and political battles in DC continue to be waged, it is inspiring to see how Senator Cavito takes on an apolitical manner to support school-based health. This is because she recognizes that the model is proven to boost educational attainment, as well as physical, mental, and emotional health, and the well-being of students. We are grateful for the Senator's representation, leadership, and partnership. We're also appreciative of the School-Based Health Alliance for recognizing her work and naming her the 2022 Congressional School-Based Health Care Champion. Thank you, Senator Cavito.
Hi, everyone. This is Shelly Cavito, United States Senator from the great state of West Virginia. I'm honored to be a recipient of the Congressional School-Based Healthcare Champion Award this year. But before I begin, I want to send my most heartfelt thanks to all of you in attendance today. As a former educator and college advisor, I have seen firsthand how important school-based healthcare programs are to our institutions. I've also witnessed the dedication and hard work our medical professionals display day in and day out, and I cannot thank you enough for everything that you do. I can't imagine how difficult it has been to navigate the past few years where you experienced so many challenges created by COVID-19, but you have persevered and been there for our students when they need it most. Keep up the good work. As a member of the Senate Appropriations Committee, a top priority for me is making sure you have the resources needed to do your jobs safely and efficiently. I was proud to vote in favor of legislation that properly funds our government and provides needed support for grant programs that directly support school-based healthcare in our communities. Our school-based healthcare providers in West Virginia continue to lead by example, and I'm proud to know that members of the West Virginia Primary Care Association are participating in the conference this week. Again, thank you for awarding me with this award, and thank you again for all of your efforts. I hope you have a great conference.
Thank you again to all of our speakers this morning and this early afternoon. Greatly, greatly appreciate all the contributions to the school-based healthcare field. And now I have the pleasure of announcing our poster winners from this week's competition. Thanks to all of you in the audience who voted. So we have 3 winners. The first place winner is poster 19. The title of the poster is Seed Digging, Pulling Sad Seeds and Planting Happy Seeds in a Child's Heart. And that poster was led by Shauna Burns, who will win a $100 Amazon gift card. Our second place winner is poster number 15, Informatics and Social Determinants of Health in School-Based Health, a Conceptual Model. And that was led by Vera Borkowski. And Vera is winning a $75 Amazon gift card. And then in third place, we have poster 18, Reducing the Future Prevalence of Addiction Begins with Prevention. And that poster was led by Carolyn DuPont, who will win a $50 Amazon gift card. So thank you so much for submitting and your hard work, and to all of you who submitted a poster. So congratulations, I see coming up in the chat box, to the winners. So thank you for your great work and your research. And we also have an event game winner. Thanks to all of you who have been playing this week. Our event game winner is Lonnie Ellis. She's a physician assistant with Coastal Horizons, Inc. in Wilmington, North Carolina. So congratulations to Lonnie. We'll be reaching out to you. So that is our conclusion for today's first plenary session. We invite you all to join us back at 1:15 p.m. Eastern Standard Time for our final workshop series, and then our final plenary closing session later today. Thank you.